COVID-19 survivors may have an increased chance of blood clots. An NTU study finds people with underlying chronic conditions could be at higher risk. And for more, the lead researcher of this study, Assistant to Professor Christine Cheung from NTU's Chian School of Medicine, joins us for more on this. Professor Cheung, firstly, with typical viral infections, patients get sick and then their immune system helps them recover, and that's the end of it. Do we know why the coronavirus triggers such a series of reactions in the body like we saw in our earlier story?
Thank you for that question. In fact, there are still many unresolved unknowns about the long-term health impact of this coronavirus. But what we found in our current study is that the recovered COVID patients, despite the fact that the virus is no longer in the body, there is persistent and overactive immune response that may still cause inflammation and damage to the blood vessels. In that will in turn increase the risk of blood clotting complications.
And Professor Cheung, did you find a link between the health profile and age of a patient and the chance of blood clots forming?
Well, in general, older people tend to have weaker blood vessels. And if these people are compounded with pre-existing conditions such as diabetes and hypertension, the poor vascular health will be exacerbated, which lead to greater leakiness of their blood vessels, and in turn, releasing factors that may trigger formation of blood clot.
And for those who develop these blood clots post-COVID, how likely are they to suffer a heart attack, stroke, or even organ failure?
It depends on the severity of the blood clots. For very minor blood clots, there is a chance that our body is able to resolve them. But for serious blood clots that block major arteries, supplying oxygen to vital organs like the heart and the brain, then the chance of getting heart attack and stroke will be much higher.
30 patients, recovered patients of COVID-19, were part of your study, Professor Cheung. Have you continued to track how they're doing?
That is a very important question. Indeed, it is very critical to follow up on recovered COVID patients in order for researchers and clinicians to continuously monitor the long-term health outcome. And that will greatly facilitate research on the causes behind post-recovery complications.
And how would someone who's recovered from COVID-19 know if there are blood clots forming? Are there any warning signs?
COVID survivors should look out for lingering symptoms if that worries them, especially fatigue, breathlessness, and chest pain. So these people should seek immediate medical advice because the doctors will be able to provide proper evaluation of the risk for blood clotting and, if necessary, recommend preventive therapies.
Well, the formation of potential blood clots is a serious health development. Professor Cheung, what can be done to mitigate such serious consequences?
Yes, the long-term care of these patients, even after discharge, is in fact very important. And that really resonates with the recent recommendation from the World Health Organization. They have actually recommended that all hospitalized COVID patients to be prescribed low-dose anticoagulant, in other words, blood thinner, to help mitigate the risk of blood clotting complication. Now, whether this could be extended to recovered patients who are recuperating from home will warrant further studies and clinical trials. But again, the recovered individual should be proactive, watch out for worrying symptoms like fatigue, chest pain, and that the doctors will be able to give them a proper evaluation of the risk and to put them on such preventive therapies if necessary.
Well, many thanks for sharing your thoughts with us this evening. Assistant Professor Christine Cheung from the NTU's Chian School of Medicine.